welcome Dr. Ali Abdel-Mageed. Who is the Division Director of the Pediatric Blood and Bone Marrow Transplant at Helen DeVos Children's Hospital. We're going to move into bone marrow. And Dr. Mageed, if you could tell us a little bit about how a bone marrow match is determined.
The process of bone marrow donation is similar somewhat to what has been described about kidney donation, that in fact you have to be alive to donate. So there is no cadaveric bone marrow or hematopoietic or blood type stem cell donation. So we really have to rely on each and every one of you to come forward and be willing to donate bone marrow stem cells. It is important to know that at least one of the main reasons that people may need bone marrow transplant is a form of blood cancer, which is diagnosed every 5 minutes here in the United States. So every 5 minutes, someone would come up with a diagnosis that their chance of survival depends on other people, just like ourselves here. The process of bone marrow donation actually would only take 1 to maximum 5% of one's bone marrow cells. And the good news is that it regenerates itself. It comes back within 4 to 6 weeks after that. So we are also looking for the healthiest of us to be able to do so. So usually you have to be above the consenting age if you don't have a related person. So if you're altruistic and you want to give to someone you don't know, you're not related to, then you need to be 18 years or older. Most registries would register someone up to 60 years of age, usually 55 to 60 years of age. And this is actually one thing that men can do better than women, is men can actually be better donors because they have not been usually through the process of pregnancies. So it's for all of us men here. So each time a woman gets pregnant, there are some of the baby cells that actually escape the placenta and circulate in her blood. And they may remain, those cells may remain sometimes for tens of years. So not to say that women are excluded, actually we transplanted so many women using bone marrow from so many women. But definitely, if I have a choice, I would choose a young man as my donor. So it's for those young men here, which I'm calling upon, you register on marrow, marrow.org, and become a bone marrow donor. The process actually will entail initially just a swab of the cheek or a small blood sample, like a teaspoon of blood, taken to determine tissue type. And then that tissue type gets stored in a national and actually some international data registries. Currently in the United States, we have 10 million of those donors ready to donate. So that's good news that 10 million of us are actually on the donor registry. The bad news is that there is more patients still who, even those 10 million, don't match them. So we need more. And also there is attrition. And there is also, the closer the match, the better the outcome. Therefore, for those of us who are of color, this is even more important. Because I would probably match someone from Egypt, that's where I'm originally from, than would match someone from a Caucasian, Northern European background. So I've been on the registry for 30 years and I've not been called upon. But frequently, if you are from the most common ethnic background in this particular location, you'll be called upon. Your chance would be 1 in 500 to be called upon. The process could be donating either marrow or even now peripheral blood stem cells. So it could be done in the operating room. It will need about 20 to 30 hours of time commitment. All the expenses are paid for. And it will include, those 20 to 30 hours are spread over about a 3 to 6 week period where one will undergo a questionnaire, a health questionnaire, a physical exam, a chest x-ray, an EKG, just to make sure that this person is healthy and able to donate. Because as every one of us has already said, first is do no harm. So once a donor is identified and goes through this process, then he or she will decide with the physician to donate the marrow through puncture of the back bone here in the operating room where someone is completely under anesthesia, or giving it through the peripheral blood. And then that marrow gets shipped. In fact, I just did one today that got shipped overseas. So that marrow gets shipped to where the patient is. One can know the patient's age, name, age, sex, and disease, and get updates as well. Because as all of us, being altruistic, the concern is how the patient is doing. I would love to make sure that this patient is doing well, and we get updates all the time about that process. And this is an incredible power that we all have. The ability with God's will to give a piece of us to make someone else survive. And that's an amazing power that we all have that I'm sure it just, because it's overlooked, sometimes not every one of us is registered on this registry. And when you really look at the dictionary, at the definition of the word giving, and you see that it's transferring the possession of something you have to someone else without compensation, I disagree about that compensation. That the major compensation actually the donor gets rather than the patient. It's that satisfaction of someone giving and feeling that self-worthiness and sharing a piece of us with another human being. So thank you all very much, and I hope you all register at the end of the night.